Here at the Veterans Center, the resident is the center of all that we do in our care. We work together as a team, including our residents and families, to help each resident achieve his or her best possible life experience. As the largest veterans care facility in Canada, we need to make sure that the care we provide is consistent, effective, and safe across all 17 units here in the Veterans Center.
You really can't provide excellence in care without having a high-functioning team. So my role as a physiotherapist is really talking about and focusing on function and physical functioning. Our veterans here have goals that they'd like to attain. They want to sustain the physical functioning that they have. So it's my role to assess that and then share it back to the team. Here when we practice and when we do any kind of assessment or intervention, it's very important to share the information not only with the resident but have open lines of communication with the family, because oftentimes the family can help facilitate progression in function. For example, would you mind buying a pair of shoes that might be, make it easier to walk around? There might be some sort of inquiry about how do you find your mom or dad or loved one? Is that different from yesterday or last week? Because their input is really important and crucial to how I do my work.
The nursing care is unbelievable. It's fabulous. And both Bev and I have worked in several hospitals, so we're pretty good judges. The other thing, though, it's the warmth and the caring and the love is visceral. It's from day one. Everyone we ran into treated us like the most important people in the world, and it was a family atmosphere. It wasn't just Dad, and we weren't just family.
The communication amongst them all is just like nothing gets left out. They communicate so everything just runs so smoothly. And one thing I'm impressed with too is they'll have a family conference every 6 months or something, and everybody's there, doctor, pharmacy, physio, nurses, everybody. And and everybody's just involved. It's more like a family than it is an institution.
Yeah, so, it really is.
And Dad's been very happy and often says, what a wonderful place this is.
So as a nurse, working with interprofessional team members means understanding each other, supporting each other, and respecting each other. We consult with each other on behalf of the residents and their family members. We collaborate together as a team to work in order to provide the patients with optimum care. So the ultimate goal of the interprofessional team is to provide the best life experience for our residents and their families.
Each and every one of the vets is an individual, and as a team, every member of the team, they learn and they know what their likes are, what their needs are. And as a nurse, I've been so impressed with the care.
It's really quite amazing the number of interprofessional team members that veterans can tap into for their needs while they live here. This can range from anything from speech language pathology to pharmacy to obviously medicine to creative arts therapy. There is at least 12 different interprofessional professionals that work here to help really enhance the quality of life for our residents.
I am so pleased to be able to launch our new Veterans Center model of care, which encompasses partnership, collaboration, and teamwork to achieve the very highest quality of care and a wonderful quality of work life for our staff. Here at the Veterans Center, together we care.